Hey, what's up, everybody? Cam Hemphill here, your host of the Medical Millionaire Podcast. Thank you so much for taking the time to tune in. My goal is to give incredible value and insight for practice owners. So if you're looking to grow your practice, scale your practice, potentially put yourself in a position to perhaps exit your practice, if that may be the case and journey for you. Every single one of these episodes we put together, they are to help you accelerate who you are as a provider, helping your patients, ultimately just becoming better and a wonderful practice entrepreneur. So I have an incredible guest on today, guys. She's out of the Sunshine State, my home state, Florida, obviously. Her name is Sara Smith. She has a great practice. Follow her on Instagram. It's called Sunshine Injector is her handle. And she obviously owns the Sunshine Aesthetics and Wellness practice out of South Florida. So she has an incredible background. She spent some time in the ICU. She now has her own business. She's board certified. She is on this amazing appreciation and approach of connecting with patients, not only through aesthetics, but also now that we're getting into this wellness ecosystem. And she has some incredible things to say. So Sara, thank you so much for joining. Welcome to the show.
Awesome. Thank you so much for having me.
So take us back. Talk to us about the journey. I know you spent some time in the ICU, and obviously, out of all the interviews that I've had, this is somewhat a common theme, And so I'm curious, going from ICU, critical care to aesthetics, regenerative medicine. Walk us through that journey.
It's been a long road. It actually started a little bit before that. Before I became a nurse, I worked as a laser hair removal technician and electrologist. So when I was 19 years old, I went to school for that. Prior to that, I was homeschooled. So I started kind of my real education doing the laser hair removal. Unfortunately, that was right after the crash of 2008. So a lot of people were not investing a ton of money in, getting hair removal procedures done. So at that time, business had slowed down a little bit. I was working at a med spa in Vero Beach, Florida. And when I had been in school, people kept telling me to be a nurse, that I should be a nurse. And, back in the day, I never thought I was going to get into healthcare nursing. I thought I was going to be a waitress forever. I was making great cash money. I didn't want to go to school. I didn't think I had the ability to go to school. I'm the first medical person in my entire family. So it was definitely a journey. But once I started that laser hair removal school, electrology school, I found a passion for learning that I never thought I would, and finally found something I was interested in. And so, went to nursing school, graduated, and at that time, I knew I wanted to get back into the aesthetic space, but at that time I was a little bit more focused on income and money, and I thought being a CRNA, working in anesthesia, was going to be my best bet. So that's what kind of led me down the ICU track. So as a new grad, nobody wants to hire a new grad into the ICU. So I was turned down by multiple hospitals in our area as a student nurse. And I found one of my professors who really believed in me, Dr. White out of IRSC, Indian River State College. And she got me into the ICU at a local hospital here. And they put me in the new grad program. And I worked there for 5 years, or I worked there for 2 years and then did some travel ICU gigs. So I've worked in every single type of intensive care unit, from neuro, cardiac, medical. I was in the trenches for a while and learned a lot, and learned about how dysfunctional the healthcare system is and how we are working against patient health. And yes, we're sustaining life, but we're not improving quality of life. We're just, putting a Band-Aid and actually making them unhealthier in the long run. Even with the foods that they serve in the hospital, and the overall environment was not where I wanted to be. So I kind of changed gears after 5 years and went into private practice and ran a vascular surgery center for 5 years after being an ICU nurse and critical care certified, and did all the things and realized that was not where my heart was going to land ultimately.
So you said something there that really stuck with me, all the way down to the type of food that they give you in the hospital, right? Was there a particular moment where you had just seen enough? You're like, look, this is ass backwards based upon how we're supposed to be treating a patient long term. Like you said, it's a Band-Aid approach. Is the protocol wrong? Like what's going on there, and why is it so? I would like a Band-Aid approach versus a long-term longevity approach.
It's just all about income and how much money. I worked for one of the biggest hospital corporations in America, and they were constantly cutting staffing ratios. So very, very unsafe environment for nurses and patients, like very, very dangerous situation. So not only from staffing ratios to the food that they serve to everything is not putting the patient first. It's really profit first over everything. And that's what really turned me away from corporate in the beginning and kind of has left a scar on my heart for sure. But the stuff that they feed the patients, I mean, everything is processed. Nothing is an actual whole food ingredient. The list of ingredients is like 25 long. Even being a nurse in the hospital, you're stuck there all day long. So you're eating that food. You're eating what's available. Because if you're in ICU, you shouldn't be leaving your patient to go and get lunch. You're eating hospital food if you didn't pack your food and bring it. And usually you're busy and running around. From the coffee to the creamer being like the seed oil based creamers. And, my health just really declined working in the hospital for so long, from the stress, from night shift, and that's kind of, my family has always been very health focused, but really working in that environment and working overnight and then doing research on how bad it is for your sleep cycle and everything to do night shift nursing, just really the focus on health isn't really there, which is kind of crazy to me. They're just running this machine, and you got to get out of the way of the machine or you're going to get run over. And so finally I just couldn't take it anymore. I couldn't watch us do that to people over and over again.
It's like a DMV of sick people and trying to get them in and out the door as quick as possible because it's a machine, right? It's a revenue driven machine that is billable to insurance through all the code based stuff. Like I can give you an example of what I went through, right? Like my wife, we were snowboarding, 4 weeks after our second child. She's a badass snowboarder. That's how we actually met. She broke her leg. And we go down the mountain in the toboggan and go, get it x-rayed and all that. And they were going to give her like crutches, wheelchair, the whole thing to take home. And I was like, well, how much? I could just buy crutches on Amazon. Like how much you charge for those? And it's so funny. The answer was always, I don't know. I'm not sure. It was just stack it on the account, bill it to whoever bills it. Somebody pays it. I pay some insurance premium that I don't even know what it's covered. It's so complicated. Apparently I need it just in case. But that's crazy, right?
Oh yeah, and that's how they get you with the fear tactic. Like, oh, in case you ever need it, and knock on wood, thank God, I'm 35 years old. I've never needed to go to the hospital for anything, and I'm deathly terrified. And I tell my friends, I'm like, I better be on my deathbed if I'm going to the hospital, because it's a dangerous place. If you go to that hospital, you better be prepared to advocate for yourself, because you are your best advocate, and the quality of care is going down, 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 down. So even my own family members, we do everything possible before we get to that position, because if you go in the hospital, you're opening yourself up to a whole lot of risk. Even as a patient in a surgery center, the things that happen to me is just terrifying, because I know too much and I watch everything. I'm just like, this is such a dysfunctional system. It blows my mind that it's been around for this long and it's getting worse and worse and worse. Instead of let's evolve, let's get better. I don't see the disconnect there. They could be successful and take care of people. It can happen.
Yeah,
it's
sure.
just they're choosing not to. So it's a little frustrating.
Well, I don't want to stay on this topic for so long, but it's fascinating, right? It's how much does a nurse make at night shift versus day shift? How many hours?
So
a day
I
work?
started at $21 an hour as a night shift CVICU. That's cardiovascular intensive care unit. So you have the sickest of the sick. You're working overnight and you're making $21 an hour, and you've got 2 chest tubes, 16 drips going. That's exaggerating, maybe 10 drips. These patients are sick. Their life is in your hands, and they don't pay the staff. They tried to put me as a charge nurse my second week on at that hospital. And I'm like, you want me to be in charge when I'm barely even trained? I've been here 2 weeks, and you want me running this whole unit with the sickest of the sick? Like, that stuff just blew my mind. So it was just your adrenaline and your nervous system is just shot. And after 5 years of that, I started getting like weird rashes, like psoriasis, which I've never been diagnosed with psoriasis. I never had a problem in my life, but the stress was literally like eating me from the inside, and I couldn't take it anymore.
So you're saying the biggest hospital, one of the biggest hospitals, and the second week on the job, they put you in charge? Holy shit. Okay.
And on night shift, you don't have the resources. You don't have someone you can call. Most of the times, you got to call the ER if you need backup, and the ER doesn't want you calling them. When you call the ER saying, I need help here, this patient's crashing, I need a line, sorry, we can't help you. Sorry, you're getting yelled at, you're in trouble. And it's like you're trying to do your best, but just like never getting anywhere. So yeah, it was a scary, scary place to be. I don't know how I lasted 5 years, honestly. I always think about going back. I'm like, please don't ever make me go back there, because I can't. I care too much. If you're a nurse that doesn't care, which a lot of them, unfortunately, are, that they're there for the paycheck and that's it. Yeah. They're not going to help anybody. I worked in a really bad hospital down south, and I had patients who really needed help. They were covered in things that I needed help with, and the nurses would turn me away like, no, sorry. And they're on their phone texting. I'm not going to help you. I had patients coding. No one would help me. It was me, the charge nurse, and the doctor, and the nurses are on their phones. It's like such a toxic environment, and the lack of care is really insane to me. So I just try to be the opposite of that. Well, I mean, so yeah, don't go to the hospital unless you need to.
No, I mean, I can't
don't do it.
All services. I'll do surgery myself. No, just kidding. But my gosh, that's really eye-opening. I've had a lot of guests on the show. I haven't really gone down the path of understanding what it was like pre-aesthetics for ICU. So I really appreciate the fact that you explained that in detail, all the way down to the nutrition aspect. Being a nurse, you're there. I'm sure it's like, hey, free meals, right? You get free meals for the nurses. Well, thanks, but no thanks, right? This is shit that you're putting in my body. I can't believe stuff like that's approved, but I'm sure it has to do with, hey, food costs. That's probably a real thing on the P&L statement for the hospital, right? Oh, yeah. Because if we're going to give free food, it's got to be shit food, because we don't want to provide anything that's healthy. The decisions that are made are just really interesting. Being in healthcare, let's change the lane. So eventually, you had enough. You're like, look, this isn't for me. I'm going to go explore a different path. You're on an incredible journey now. How long has it been since you left the hospital?
5, 6, 7 years, I think it's been.
7 years.
I went back in 2020, so I did work a few shifts in the ICU during COVID, which was eye-opening and sent me away very quickly, because that was just a mess. But yeah, that was 2020 was probably the last time I was in the hospital. So yeah, 6 years.
Can I ask you a question on that, since you went back and did that?
Yeah.
My question is there was so much information, misinformation, internet this, shadow ban this person. It was crazy what the public went through, and so desperate for truth, right? But I would always hear that the protocol was, once they came in, they just put them on a ventilator, and the ventilator is basically what took over, and it killed a lot of people. Is that what you saw firsthand, or?
No, there was a lot of misinformation in the media. I personally saw tons of patients with COVID, and very few were on ventilators. I was even floated to the COVID floor. So I think there were a lot of scare tactics involved to push whatever agenda they were trying to push. But notoriously, when a patient's on a ventilator, regardless of their diagnosis, their lungs get weak. You're breathing for the patient, so their muscles aren't contracting. So all patients go through that. I don't know that COVID was any different. You have to wean a patient off the ventilator. Basically, you turn down the settings and get the patient to breathe on their own while the tube's still in. So you build up their musculature. So I wasn't in it long term enough to say, okay, I saw a big difference with ICU or with COVID versus non-COVID patients. There was a lot of false information that I can definitely guarantee was pushed out there for financial purposes. Very scary. A lot of misdiagnosis, patients in car accidents, but if they've tested positive for COVID, the cause of death is ruled as a COVID death and not a traumatic motor vehicle accident, which was actually the cause of death. So a lot of stories like that I heard.
Yeah. So you went back and you're like, nope. Okay, quick reminder, I'm out.
No, and just their protocols they give you a brown paper bag, and they're like, okay, you have here's your mask, here's your shield. You're going to put it back in this brown paper bag all day long. So you're telling me I'm putting a mask in and out, bacteria contaminating everything inside this bag, but then you want me to put that back on my face. And no one trained me. No one told me like I'm a new person coming into the hospital, no COVID training. Thank God I have my own knowledge of, sterility. But the stuff they subject you to, it was insane. And I was like, okay, I'm done. I'm not coming back here after this because it's just so backwards.
Jeez, like
like that makes sense.
How is that the protocol? Like, let's just use our brains here. Common sense is a real thing, and should be used. So, well, let's segue. So now you're in aesthetics, you're in wellness, you're in longevity, you're on this new path. And I mean, you were smiling ear to ear, by the way, so if you guys are not tuning in on like the YouTube, she seems super happy. I'm sure like she's just on this amazing path. And so talk to us about, okay, I know you made the decision. You're like, look, I'm leaving the hospital, but I'm sure there was a moment to where you said, what am I going to do? Will you walk us through that path into where you said, I'm going to get into aesthetics?
Yes, so I always had aesthetics in the back of my mind. I just never thought I was going to get there and never thought I was going to be what I thought I was going to be. So after I left the hospital, I worked in vascular surgery for 5 years, and that was a private practice. So thank God for that position because I learned so much about running a business in that role. If I hadn't have done that role, I really wouldn't know what I'm doing in this role with, just facility standards, OSHA safety, biomedical safety, things like that. So during that time, my best friend had actually gotten me the job at that surgery center. And then after I'd worked there a few years as charge nurse, she came back on as our nurse practitioner. So we were both working in the same facility. And she's the one that hounded me to go back to school for my nurse practitioner. And I mean, she hounded me like every day. And finally, I'm like, you know what? It's a 2.5-year program. It's going to take me forever. I'm just going to sign up. And I just did it. And then once I, started taking those classes and getting closer and closer to my goal, I knew I was going to get back into aesthetics. But at that time, I did not know I was going to own my own practice. And really, it was only the fact that no one would hire me that I had to go and own my own practice because no one wants to hire a new grad. No one wants to hire anybody without experience, but I've been through this before with ICU where they told me I can't and I come out on top. So I'm like, all right, I'm going to do it myself and just paid. That's why I've taken so many trainings because I had no one to mentor me, no one to give me a shot. So I just, maxed out every credit card that me and my parents had, took every training I possibly could and, started my own little practice. But people thought I was insane and I even thought I was a little insane. I still might be a little insane.
Well, every entrepreneur, everybody has a little bit of that. And that's what makes us unique and that's what makes us special. And that's why you have Sunshine Medical Aesthetics and Wellness, right? So you have to go through that. So yeah, I mean, I read on your bio, you have over 50 advanced trainings that you completed since 2024.
Mm-hmm. I'm a little obsessed. And that's not even including, I have several Patreon memberships, which Patreon is a paid platform where you can go and watch training videos for any injector that you think is the best. So I'm just constantly, if I'm not working, I am watching videos. But it's not hard because I love it, and this is what I've wanted to do when I was in NP school and regular RN, BSN programs. It was like pulling teeth to try to read the material, it was just something I was so uninterested in, and a lot of the answers were, it was incorrect information. Even when I took a nutrition program, it was all about, to maintain the vitamin quality of your food, you microwave all your food. Like simple things like that. I'm like, that is not the correct way to, live. It wasn't nutrition focused. It wasn't health focused. So now that I finally am doing something and learning something I love, I'll keep learning till they kick me out. I don't know. I love it.
I think it's super important. Go through as many trainings as you can is only going to, self-develop who you are and really double click on your area of expertise, and patients see that, right? And patients are very loyal to their provider when you deliver an outcome, when you deliver an experience, when you deliver transformation, right? So talk to us about that. You have aesthetics, you have wellness. How do you combine those two into a wonderful patient experience?
So I am very heavy aesthetics focused, which now I'm transitioning more to the wellness side. I have my whole background from just my family and things I've learned as my own health advocate. But I just finally started training. I went to a conference 2 weekends ago for A4M, and it was all about bioidentical hormone replacement, the wellness space. So I am just kind of starting that journey as a nurse practitioner. But I do have my own knowledge from being, I was in a bikini competitor. So I learned a lot about dieting, losing weight, kind of biohacking your body during that. But I am very aesthetics focused. So, but even when I get an aesthetic patient in, I'm looking at them as a whole. If I see their skin has a ton of sun damage, okay, what are you doing? Are you using sunscreen? If I smell cigarettes, I'm going to start talking to them about cigarette smoking and how can we get you to quit. And I try not to bully them, but I also don't want to miss that opportunity. If they were looking for a reason or looking for an excuse, I want to be there to help them. I talk about their vitamin intake. Most patients complain weight gain and fatigue and brain fog are like the biggest complaints. So instead of just looking at their aesthetic, I stop. I'm like, all right, let's talk about this. So a lot of patients are surprised by that because most aesthetic providers, they come in, they're there to do a job. They really don't even assess the patient. They just start injecting and they do the same dose for everybody. I talk with them for 30 minutes. I find out who they are. I ask about their family, about their life stressors, because all those things impact what we're doing. We talk about nutrition. We talk about whatever else may be going on. Then we dive into the reason why they came. And a lot of them appreciate that. And that is what sets me apart. You know, I may not be the smartest person in the room. I may not be the best at everything, but I care. And I want to help them on their journey to learning about their health and helping them get better so that they can decide what's going to work. And every patient's different. You give one thing to one patient, they're going to react one way. You give it to the next one, they're going to have a totally different reaction. So just listening to them and kind of doing what they think is best and kind of guiding them down that path and not being pushy, because that is, I think, the biggest thing that turns people away is being aggressive, being pushy, not listening to what they're saying. That's really brought me a huge clientele because the med spas around here are money driven and that's all they care about. And so many people get into aesthetics for money that should not be in this space. Dentists, chiropractors. Yeah, if you have a passion for it, great. But 99% of them take no trainings. They don't focus on it. They're not passionate. They want to learn what they have to learn to do it to the patient to make the money. And they don't take it a step further than that. So I try to really be different. And the patients see a huge, when they've been to 10 med spas and then they come to me, they're like blown away. And that's why our reviews have been so great. And I'm so appreciative for them relaying that to other people. But that's really helped because I started out as a nobody. Nobody knew me. There's a lot of really big med spas in this area. So I've gotten a lot of their patients, and it hasn't been too difficult in that aspect. Because once they come, they're sold.
I love that. Like what you're saying is it's so refreshing. I want you to know that because as a patient myself, we're desperate for expertise. We're desperate for honesty. We're desperate for help us, ask us questions. Did your consultation process come to you naturally? Was that training? How did it? Because most providers do not have that skill set. They're afraid of that skill set. They look at it as me being a salesperson versus an educator and somebody there to give them care.
And that's why I thank God that I didn't go into corporate because I had to do it on my own and I found my own way and it works and it's what the patients are craving with this whole AI generation where no one's listening to them or they become just a number in this whole, they want that human connection. So even if you do nothing for them, even if you make no money and you don't make a sale, you've made a connection and you've helped that person because most people just want to talk. It's talk therapy. If they could get out whatever's happening, their bodies will heal themselves. And that's kind of going back to what we talked about, the pillars of health. Your body knows how to heal. If you give it the proper ingredients to make the things it needs to make, your body knows what to do. We just have to get out of our own way. And, I'm big on talking patients out of stuff. I'm not going to push you on. If you want it, great. I'll educate you, but I'm not here to sell you. And that's been huge. And yeah, I don't make a huge revenue like these other practices, but that's not my goal. And my patients are thankful for that. And I do have very wealthy clients that do spend a ton of money but I'm not going to push them on stuff that they don't need. And I try to really spend their money wisely instead of wasting money on things that's not going to make a huge difference for them. I don't like gimmicks. I only carry the best of everything. I trial everything on myself first. So I'm a little bit of a nightmare for drug reps, pharmaceutical reps, because I'm not buying it if it's not the best of the best quality. So
Yeah,
they, they
I mean, you should trial it, right? Instead of just put it on the patient, looking at it like you said it yourself. Instead of a money lens, it's a patient care lens. And here's what I've seen: is the patients have become much more intelligent over the years, right? We have
oh yeah.
access to the internet. We have access to AI. We've probably been to 4, 5, 10 different med spas. I mean, I've been to hundreds, and I've been in lots of consultations. There's very few that I've actually been in that I was felt heard, felt like I was sitting with an expert. Maybe the experts, taking place when they're doing their job, the actual treatment, right? Obviously, that's part of the deal. But at the same time, building out a treatment plan, understanding exactly what is going on and how can you address everything, and really caring. So that's huge. I mean, guys, she has a 5-star rating on Google, 90 reviews. One thing that she mentioned that I thought was really interesting was you're organically taking patients from other med spas. It's not like you're out there trying to take business. They're finding you because they're finding you through word of mouth. They're finding you through, oh my gosh, I've been to so many practices. You have to go see Sara. She actually listens. She actually cares. The consultation's a half hour, 40 minutes. It's not just transactional, it's transformational. And you're right. These practices that are around there, you're in a big population area, right? Like the population is pretty large. There's options, practices on every corner. You're taking them because you're coming at it from a trust and transformational transaction.
And I hear all the horror stories, the stories my patient, it's 10 stories a day from what they experience. So I know everything that's going on at these other med spas, aside from the fact that I've been a patient at many, many med spas. So I've seen firsthand that they don't care. They don't know your Botox dose. They don't assess you. They don't map you out. They come in with the Botox pre-drawn. You haven't even assessed my muscles. How do you know I need 60 units? You didn't even look at me, but you're putting the same dose into every single patient. I don't get it. But the patients tell me everything, so I know all, and I know we're doing a good job here. So I'm very happy about that, because it's definitely we stand out for sure in that department.
Talk to me about the facility, because I know this is a boutique offering, intimate setting. Is it that way by design? Do you plan on bringing on other providers, building out your treatment rooms? What's your thoughts there?
It is my worst fear to scale and grow. I know I shouldn't be saying that to you, but because I came from that big surgery center and dealt with a staff of 20 plus and saw how hard it was, and it was, a very rough go, that scares me from growing my practice, because when it's me, I have control. When you bring in so many people, you don't have control. You could do all the training, you could do all of that, but if the person doesn't care, that's what I have a hard time finding. Like, thank God I found my assistant, Jo. I got super, super lucky with her because she cares and she's passionate about what she does. But I feel like I kind of found a needle in a haystack, and maybe that's my negative mentality. But I don't really want to scale and grow. I kind of want to stay small. But every other training I've been to, it's all about scaling and growing, and I don't know that I want to do that, but God forbid anything ever happens to me, I'm going to be in trouble, because I'm not going to be financially, stable if I don't build a little bit of, of a staff. So we will see. But I just have a little 2-room facility here. I really don't even use my spare room, just mainly in this exam room in here. And Jo, my assistant, she is an RN, so I will be growing her. She's going to be going to NP school this year, so growing her into an injector eventually. It's hard because I always have my guard up. I've seen what staff can do. They've let me down so many times. I've been hurt. I've been lied to. So I'm nervous about that aspect of it. You get burned a few times. It's not so easy.
Look, it's everybody's on their same journey, and your journey is your journey. It's not, You don't have to be on let's scale, grow, because you have some scar tissue there, right? And that's real rooted scar tissue from the hospital, from people not being honest, from people not putting their best foot forward. Look, working with people, what I've learned in business, in aesthetics, outside of aesthetics, everything, people are the absolute hardest to work with. You can do everything: instructions, playbook, shoot, performance-based compensation, trainings, SOPs, and it's just like, I can't help you any further. Like,
I
it's you
know.
have, and then you
And it's hard
hire
because
them, they have to go, and then you're
I listen to people all day, but sometimes I'm like, man, I see why AI is taking over, because you can trust, well, for the most part, you feel like you can trust AI. You don't have to worry about AI manipulate. Well, it can manipulate you, but sometimes AI is better than people. When I see the way people care about people, I'm like, I'd rather talk to a robot than the way you just talked to me at this. Like, there's no customer service anymore. I am like amazed when I go out into the world how businesses are still functioning with the way they treat people. It's just kind of scary to me. We've lost that humanity, which, seems to be widespread. So I don't know how that's going to go. But yeah, I like to keep it small, keep it safe.
Yeah, no, I totally get it. Especially on the AI side, there's been several times where I've called into a company or I've practiced with an AI voice agent. The AI voice agents are coming a long way. And if you train them correctly, they're very intelligent. They can pull data from your website, data from your EMR if you want to. You can build a full-on SOP with ChatGPT or Claude or whatever type of tool you want, feed it, and it can sound like your front staff. And that AI agent doesn't ever really have a bad day, right? And maybe
Yep.
it's not, you don't have that exact human touch. You can tell, you can sniff out it's like an AI person, but it's the same experience for everybody. And sometimes it's like, I just want the answers as the patient or client right away versus having to deal with, grumpy
Yeah.
Sally.
AI is not going to yell at me. I've been yelled at several times by companies, and I'm like,
For sure.
who's in charge of you? I mean, you guys are just going rogue here. But it's funny if I could go off on a little tangent. I did have a bad Google review, my first ever Google review, which we've gotten resolved because he basically blackmailed me into taking it down. But it was a tow truck driver. I had a bad experience. Was a like the guy basically got into a little altercation. He was not kind. I called his boss to let him know. And the guy heard my voicemail, my business, and left me a bad Google review. It basically forced me to take it down, unless I took my Google review, of his poor employee. And had he just called me like, hey, I'm so sorry about my employee, we'll do anything to make it right, I would have taken it down. But we're at that, day and age where it's like so shisty. So it's scary running a business and trying to maintain your reputation, because something that's not even related to your business can affect you. So you do have to be careful as a business owner, when you go out in public, if you're wearing your scrubs, whatever you do, you're just, you kind of gotta keep your guard up at all times. But yeah, AI is very promising, because at least AI will be nice to me at all times. It doesn't really step
Yeah.
out of line that often.
Yeah, I have something to share with you on that too. And this is a total just sidetrack, but I have a good friend that has a practice in Miami. Great guy. And there was a gal that went into his practice and she was flirting with him. And he has cameras up and he's always filming and stuff. Well-known guy, great reputation. And she's like flirting with him and kind of was like touched him on the arm and stuff. And he had an MA in the room. And they get out of the room and the MA is like, what the heck? That girl's like touching you. Like she's kind of like flirting and coming on to him a little bit. And he's like, weird, whatever. Anyway, she called like 2 or 3 days later and said, hey, I want a refund for everything I've ever spent there. I felt really, it was inappropriate how you touched me. And so she was trying to extort him. And he just refunded her, had like lawyers draft up documents and sent it to her. He didn't even do anything wrong, but could you imagine if she just went and published like some crazy story out there?
Oh, yeah.
You know, I
Oh
mean,
yeah, and these
it's terrifying.
patients will do anything to get free treatments. They will lie. So you have to. It's hard to weed it out before it's too late. Like before I put a needle anywhere near your face, I want to know if you're crazy. But sometimes I know it, and I still have to like, what am I going to do? Kick this person out? But Yeah, that's the hardest part for me right now is trying to weed out these people because they're predators. There's a lot of predators that are out there trying to, make a buck here, make a buck there, and they don't care what they do to get their way. So,
Yeah, not to
your
like,
poor friend.
yeah. I mean, he was like, dude, I'm like, but you have cameras and you have all this stuff. He goes, it just made more sense just to refund or move on with my life. And I'm
And
like,
that's what's
what if she came
hard.
back to you? Yeah, it's like, what if she came back in 2 or 3 weeks? It was like, pay me more money. I figured out maybe you're somebody I can extort money from. He's like, well, we had lawyers get together and draft up like non-disparagement documents. I'm like, oh my gosh, you had to go through that crap. So the lady, just stole so much of his time, stole so much treatment, and then tried to use that against him was just really unfortunate. And so back to what you were saying, with the tow truck experience, it's an interesting world. We got to be cautious. I think there's some improvements there with AI. There's also some downfalls with AI. But to move on, I know that you're also now. It seems to me like you're very passionate about nutrition. You're passionate about health. Obviously, a big part of your business right now is aesthetics, but the shift into wellness, right?
Hmm.
Where do you see your practice going in the next 12, 18, 24 months into longevity, hormones, peptides, regenerative medicine?
It's hard because it's such a huge field, and I don't want to do a disservice to my patients. So I have had to turn tons of people away for hormone replacement therapy. I have patients coming in all the time wanting it, so I've had to send them away. So that really kind of drove me to want to start learning more about hormone replacement therapy, and then seeing how many patients are mismanaged with hormone replacement therapy that I'm like, okay, am I doing them a disservice by sending them away? Yes, I don't know everything, and I'm not the best at hormones, and I know I have a long way to go, but at least I know the basic safety stuff to look out for, like with testosterone replacement therapy. The high hematocrit makes you at risk for blood clots. So many of my patients, they ride with this high hematocrit, then they end up with a severe DVT that ends up into a pulmonary embolism and all this stuff. And I'm like, we knew this 4 months ago, and you guys didn't do what you were supposed to do to, one, decrease the dose, to do blood donation. So all these things that I'm like, I want to get into it, but I know it's a big undertaking and I'm so aesthetically focused, but I am starting that journey now. I'm reading 2 different books right now on hormone replacement therapy. So I'm not quite ready to offer it yet, but I have started down that rabbit hole, which is a very, very deep rabbit hole to go down, and a lot of misinformation based on the black box warning from 20 years ago that came out saying that it causes blood clots and cancer, and now they're finding that bioidentical hormone replacement actually reduces your risk of breast cancer, prostate cancer, all this stuff. So I'm really excited about it, and because I'm 35, I'm getting older. My older sister's going through perimenopause, and she's looking for my help, so I'm like starting to guide her. At first I'm like, oh my God, you're being dramatic, you're only 42. And then after I went to this conference and they talk about how early perimenopause can start and how providers constantly ignore patients, I'm like, oh my God, I am that person ignoring my own sister and thinking she's crazy. And it's actually a hormonal imbalance that's causing these issues. And, so I'm going to start going down that path and I'm learning, but I'm not going to be probably ready for a long time. But I am passionate about wellness and health, but it's intimidating because it's a huge field. There is so much to know, whether supplementation from testing. Now you got genetic testing, which is opening up a whole nother can of worms. So that's why I try to focus patients away. Let's not get too complicated if you're not even covering your basic stuff. Let's not try to go down that road until you get all this in place, because most of the time, if you fix the basics, everything else will fall into line, and you're not going to have to spend all that money on all that gene testing. All these inflammatory disorders, eczema conditions, GI concerns that they've called irritable bowel disease and don't really have a reason or a cure behind it. They just put you on symptom management. I've been able to help a lot of those patients with just probiotics. The simplest answer has cured their rashes, cured their eczema. A lot of the Alzheimer's patients have been linked back to their gut microbiome. So it's our gut microbiome that's causing Alzheimer's disease, as well as estrogen depletion and things like that. So simple stuff that we can fix to prevent this disability and all these problems for people. That's like the simplest answer, and it all goes back to what my dad always told me. He was a health nut growing up, and my mom and him kind of get into it because she was more like on the opposite side, and he was like, everything's related to nutrition, and like anything, if I stub my toe, I tell my dad, like, man, my toe really hurts. Well, what did you eat today? I'm like, Dad, that has nothing to do with what I ate today. And now I'm like, oh my God, my dad was right. All these things that he ever said, it's just simple stuff. It's what you're eating and what you're putting into your body will set you up for success or set you up for failure. And then every other system starts failing after that. So I'm excited for the future, but I got a long way to go in that department for sure.
Yeah. I just came back from a conference this past weekend, the BAA conference in San Diego. Pretty great conference.
Cool. You were there?
So, yeah, I was there. The guy that puts it on, Phil Stamper, he's a good friend of mine, and he asked me to come moderate. I moderated 2 talks. One was the longevity talk. And so I had like 3 experts on stage. People from the crowd were asking questions. I think the talk went a half hour over because it was so engaging, which was a tremendous amount of fun. And then we talked about AI as well. So I had another talk on AI, and I had some experts on the stage. That talk also went about a half hour over because these are 2 really hot topics, right? And it's just interesting to hear everybody's opinion and really hear there's some wonderful experts there and how they got into it, what trainings they've gone through. For me, I've taken GLPs, I've taken peptides, anywhere from NAD to Sermorelin to tirzepatide to all of them, TB500, BBC 157. But I've had a pretty crappy protocol. It's like a self protocol, which is me trying to find AI. And because I go to the providers around in my local area, there's not too many of them that understand how to put together a protocol and actually when it's appropriate to take these peptides. I think we're all just like craving to feel better. And they had so much information on protocols, and I'm like, I can't wait to talk to you because that's what we need as patients. I don't want to go to Hims, or I don't want to go to the internet and buy this crap and not know it. I need it from a provider.
And a lot of these people are pushing these peptides that don't know a thing about consequences of the peptides. It's like, yes, peptides are great, but you're messing with people's hormones. So if you don't know what you're doing and you're not monitoring them and you don't know the risks, and so the patients come in, they just want all these different peptides. I'm like, okay, well, let's slow down. Let's not start you on 5 peptides at once. Let's piecemeal this because God forbid you have a reaction. Now you don't know what you're reacting to. But there's a lot of these peptide clinics that want to put people on every single thing. And like one of my patients, I've talked to her about peptides forever. She went to this clinic, got put on all these peptides. Well, then she ended up having severe vomiting, nausea, ended up in the ER, all these different things. And now we don't know what caused it or where they're getting their peptides from. Is it contamination? Is it dosing? So I'm very careful with peptides. I only carry the main popular ones, the Wolverine blend, copper peptide, the GLPs I love. Yeah. And Sermorelin I'm just now getting into. I don't really go into the Tesamorelin, Ipamorelin, because there's more risks with those peptides. So I just try to, talk people down. I'm like, let's start slow. Let's be careful because, yeah, it's a peptide. Yeah, it's great. But what is it doing inside your body and what other side effects can it be causing? So sometimes more is not better. Less is more a lot of the times. But I do love the peptides. But I'm careful with them because a lot of them cause angiogenesis. And so depending on the patient's history, whether it's cancer, esophageal varices, we don't want to cause growth of blood vessels in every single patient. That can be a little risky.
Yeah, no, great point. I think it's brilliant how you say that. I really appreciate it because less is more in a tremendous amount of cases, right? And we don't want to have any adverse effects after we just like soup bowl the whole thing. We don't know, if is this right for me? Is it not right for me? I've had a lot of benefits on GLPs. I'm fit. I work out. I have all my protein intake. I have a nutrition. A lady that does all my meal prep. She comes to my house. She cooks. She goes to the grocery store. Guys, exactly what I want. We have a whole plan, and I just microdose it, right, just for some inflammation benefits. And but I think that like I've seen some before and afters of some celebrities, and I'm like, wow, that's like you took quite a bit.
Oh yeah, and I'm a huge fan of tirzepatide, but I think I do have a complication from tirzepatide in my own body, which a lot of providers don't talk about. Am I going to stop taking tirzepatide? No, because I love tirzepatide. I think it's the best thing that ever happened to me. But what we found, and it's not available in the research yet, but from me talking to different gynecologists, I had some bleeding issues with my menstrual cycle, which was then linked to uterine fibroids. Unfortunately, none of that started until I started taking the GLP-1s, and it has since become a big problem for me. So part of me is a little worried and a little concerned, and now I've had 2 patients who I started on tirzepatide who had breakthrough bleeding. So now I'm like, okay, there's something there with tirzepatide. It's not yet there in the clinical research, but I'm finding it in myself and in a couple of my patients. So there's always side effects. There's always risks to every single thing we do. And I try to be as honest with the patients. And yes, I scare the crap out of a lot of people, but I want you to know this is what can happen. You either want to take the risk or you don't. But there's a side effect to everything, even vitamins. You take them on an empty stomach, you're going to be sick. You need to eat meals before you take your vitamins and fluids. And yeah, so...
I've made that mistake before. That's for sure.
Oh yes, it's not fun. Not fun.
Yeah, zinc on an empty stomach definitely is not good. Yeah. So no, it's look, I really appreciate you coming on the show. Thank you so much for sharing your journey, everything that you've been through, where you see aesthetics and wellness going together, your transparency and how you communicate with patients. Being vulnerable and what you went through inside the ICU and what put you in a spot here to really help patients, see new light and deliver a wonderful outcome. And so, guys, I would encourage you to go follow her. Right? Again, your handle it's Sunshine Injector.
Sunshine Injector. Mm-hmm.
Okay, her handle Sunshine Injector. Go follow her, reach out to her, connect with her. She's taken over 50 trainings, guys. She is organically taking patients from other practices by doing good for the patient, not by trying to market to them, right? They are finding her because she's delivering transformation. She is connecting with them. And that is the best way you can do it, is just like providing exceptional patient experience. That's what we're looking for. And so that's what I hope you guys get out of this interview is she took the leap to open up her own thing because she wanted to control her own destiny, right? That takes courage. That takes somebody that is willing to step in the unknown and then also deliver an outcome that she is comfortable with, not what everybody else is doing. It's what Sara is comfortable with. She's on her journey. And so I think a lot of times we get caught up in social. We get caught up in where people are at in their different journeys, scaling. Maybe it's not for you. Maybe it's not for you right now. Maybe it is down the road, this is our own journey, guys. And so again, Sara, thank you so much for your time. I really appreciate you sharing this with us. Guys, go follow her, and I'll leave it at that. Until next time.
Thank you so much, Cameron. I appreciate your time. You've been awesome. Very nice to meet you. Bye.
Okay.